This is Josh Halls for FNP 597 Clinical Residency and Practice Management with SOAP Note Week 4. This is a well child visit for a 14-year-old Caucasian male born in 2006. He is not married. He currently lives with his parents and 4 siblings. The patient presents with his mother, and he himself is a good historian. Chief complaint is a wellness check for school and sports. Patient has no illnesses at this time, but he is here for the physical and wellness check. Patient is doing well with no major concerns today. Past medical history was he was born at full term, no known medication allergies, and no seasonal allergies at this time. His family history is he had an aunt and a great-grandmother with breast cancer. His grandfather had non-alcoholic steatohepatitis. No family history of sudden death or under the age of 50, SIDS, drowning, or congenital deafness. Again, social history, lives with his parents and 4 siblings. Patient denies ever trying tobacco, alcohol, or illicit drugs. He denies any sexual activity. He does admit to playing sports 5 days a week and being very active with his friends on the other days. No surgical history at this time, and patient claims he's up to date on mother claims he's up to date with immunizations, plus having the COVID vaccine. His review of systems is that he has no fevers or chills or distress, follows rules generally, relatively good at corrections, and uses a seatbelt. His eyes, patient denies any glasses or denies any double vision or loss of vision. Patient denies any tinnitus, dry mouth, throat pain, and trouble swallowing. Cardiovascular denies any chest pain, tachycardia, or edema. Pulmonary, patient denies any shortness of breath or using expiratory muscles to breathe. Gastrointestinal, patient denies any abdominal pain, constipation, diarrhea, or vomiting. Denies any voiding issues at this time. Musculoskeletal, patient denies any pain or ailments to movements or muscle use. Integumentary, patient denies any lesions, rashes, open wounds. Neurological, patient denies any seizures, headaches, or weakness. Psychiatric, patient denies any feelings of depression or impending doom. PHQ and GAD scores were taken, and both the score is 0 today. Endocrine, patient denies any heat or cold intolerances, polyuria, polydipsia, or polyphagia. Hematologic and lymphatic, he denies any bruising, petechiae, denies any enlarged or swollen lymph nodes, and again, no allergies to medications or seasonal. His vital signs was a heart rate of 73, temperature 36.4, blood pressure of 110/62, respirations at 16 with on room and 99% on room air, with a 0 pain, height of 173 centimeters, weight of 52.8 kilograms, and his BMI is 17.54 kilograms per meter squared. No labs or pertinent studies done at this time. His physical exam with a general survey of no apparent stress, no unexpected weight loss, and vital signs within normal limits. HEENT is normal cephalic. Perla, his gaze is conjugate, no conjunctivitis. His tympanic membranes were thin and clear without abnormalities. Nares are clear. Oral pharynx is pink and moist. His tonsils were about 1 plus with no obvious dental caries. Vision was 20/20. Neck is supple with no lymphadenopathy. Thyroid was palpable. Chest with no rales, wheezes, rhonchi, or expiratory prolongation. His chest is bilateral movements and within looks normal. Cardiovascular, his lungs were clear as well. Cardiovascular is a regular rhythm and rate with no galvus, bruits, or murmurs noted upon auscultation, and his pulses are 2+ in the pedal and apical. His abdomen was soft and non-tender, no masses. Genitourinary, patient deferred, no need at this time. Extremities, warm, well perfused, gross with full range of motion, equal length, symmetric with muscle bulk. His back is straight without evidence of curvature or scoliosis. His neurological, again, Perla, normal tone and strength, normal deep tendon reflexes, and his cranial nerves 2 through 12 are grossly normal. Psychiatric was pleasant, interactive, and appropriate for his age. So it's just a well child exam. for a differential. Overall, doing well with no major concerns. Family had no concerns. He is cleared to play sports. His behavior in school is well within normal limits for his age. No social problems, anxieties, depression. Patient is doing really well. We will follow up within 1 year unless something else arises and mom knows that she can bring him in at any time.